Welcome to the Preventive Medicine Podcast. Help us change the paradigm of medicine from keep people alive to help people thrive, one episode at a time. And now, here's the show.
Makes sense. And I think one of the things that stood out the most in that book, and we've had a lot of conversations like this, Austin, where basically it's, if a cure is necessary, is it possible? And if it's possible, is it necessary? Right. So I think like you were talking about, I think so many people have this maybe false idea that we can cure everything that we can catch early. Right. So it's like, well, if we catch this cancer, like we used the example of cancer earlier, if we catch it earlier, we'll be able to treat it better. And that's a lot of the times not the case. And cancers that we can catch earlier, things that we can catch early, a lot of times don't benefit the patient to treat early until they become symptomatic. And things that, we would like to be able to catch early are the things that we currently aren't able to catch early or don't have good treatments, even if we catch them early. So I think there tends to be this I guess, error in the mind of the patient that, well, if I find it, they'll be able to treat it. And then also the error of commission on the side of the physicians of, well, I need to do more for this patient, not less. So what more can I do to help them, do things or prevent things?
Oh, yeah. Yeah. I mean, even culturally, this is kind of ingrained in the process. So I might have a student or an intern presenting a situation on rounds, and they come up with their problem list, and every problem they go through, the question's, all right, what's your plan for that? And that there's kind of like an implication there of like, you need to be doing something about that. Whereas ideally, it's like, it's perfectly okay to say, I don't think this needs intervention. But there's this jump to, I want to make sure, I want to come across as being very on top of things. I want to have a plan for every problem this person has. Whereas like maybe most of them, you can just like let it ride and they'll be okay.
Mm-hmm. Yeah, I think from a lot of what we just discussed right now may apply more to physicians and clinicians and people with like a background in this though. So let's say I'm like a general layperson coming in who wants to get a whole body scan, because whole body scans let me know whatever's going on in the body, right? And then I can find out if I have something going on in my chest, something in my legs, whatever, so I know. And then in one of our previous podcasts with Dr. John White from WebMD, he talked about communication and how that's one of the biggest aspects of preventive medicine and being able to communicate what you know and the proper knowledge to the patient. So what do you tell a patient? Like, how do you communicate it to them so that they understand if they want to get a whole body scan?
Yeah. So I'll preface this by saying I never jump to tell people things. That's never going to be the first step in this situation. The first step when they say that is going to be, tell me why. Tell me where you got this idea from. Tell me what you know about this. That's almost always, across all the contexts that I'm in, whether it's a outpatient consultation, inpatient consultation, a coaching situation, the idea is first, I want to elicit where they're at so that I can reflect back to them. I'm paying attention to the words they use, the language they speak. I try to get a sense of their education level. I try to get a sense of where this came from so that I can address them kind of at their level. And so maybe they just said, oh, I saw this highway billboard sign to get full body MRIs or something like that. And so I thought it'd be a great idea. Well, that gives me one avenue. Right. So that gives me one avenue that I can start going down as far as, the potential, the potential benefits of that, the potential risks of that, and kind of where this trade-off ultimately shakes out. Whereas if they got told it by another doctor or by, another trusted friend who maybe they heard it from a friend who went through it and they found something, there's a whole lot of ways that you can get your foot in the door in these conversations, but just jamming your foot through the door right off the bat is never the right way to go when you're having these conversations. So always start out by eliciting what their initial understanding is and using that to work through it. And then from there, basically, I would aim to enlighten them or to help them understand that there are potential harms to this. And that for people who feel fine searching for every abnormality in their body, the idea of not wanting to miss anything means you end up catching everything. And just because you catch everything, a lot of it is probably going to be of no consequence, and helping them understand that our bodies are pretty remarkable things. They can take care of themselves in a lot of ways, right? Like just the physiology involved in like maintaining your own normal sodium level is pretty impressive. That's going on there. And so a lot of these things, just because we catch it doesn't mean that we need to do anything about it, that people aren't fundamentally broken, or that they don't have dangerous, ominous things going on under the hood, because a lot of people use these kind of like mechanical type analogies to describe things. And so I think that I would start with that, and then to to establish some confidence in the shared plan, I would actually follow that up with recommendations for the things that do work, rather than just dismissing them and saying, nah, we're not going to do that, go home. Rather saying, I don't think that that's necessarily the best thing that we can do for you here, but here are the things that are likely to give you the most benefit, for example. And there are, a small handful of things that would be very strongly recommended from a screening preventative standpoint that we can do, so that you're establishing a plan that is based in evidence, and you're demonstrating to them that you understand where they're coming from with their concerns about the potential for future disease and death. And here are the things that we know that we can do to provide you with benefit.
Preventive medicine is an incredibly important topic. I want to thank you for taking the time to watch this video. For the full episode, find us on your favorite podcast streaming platform. If you enjoyed this video, don't hesitate to hit that subscribe button, like this video, and share it to keep that message spreading. Thank you once again for watching this video, and we'll see you in the next one.